Hey, good morning from Dulles Airport. It's bright and early on my way to Nashville. Let's get this party started. Heading over to Centerstone, one of the National Council members based in Nashville. Great organization, and I'm going to spend the day talking to David Guth and some of his senior staff.
It means a lot to me when somebody from National Council, particularly Chuck, comes to visit. I think it's important for us because we generally have an opportunity to get really deep into some big issues that impact the people we serve. But I think it also helps the National Council folks get a feel for what the challenges are, what the service delivery system looks like here.
Anna, do you want to talk a little bit about what you're doing with the military?
Everyone that works for Centerstone Military Services has a military affiliation. And so they're able to treat the clients with a peer connection, lived experiences.
So you've got these 1,500 clinicians around the country. How do people come to you to get this care?
The Wounded Warrior Project is our largest partnership. 97% of the people who come to them and say, I need mental health support, they come to Centerstone.
As the cost to the service member or their family is
Zero, always zero. And then we have this partnership with Becky's folks where should someone find themselves in the midst of a crisis, we have a warm handoff directly to her team.
So Becky, you're doing crisis services for all of Centerstone, all states?
Yes.
Wow.
And then we operate 4 988 centers. We run a national backup for chat and text, and then an LGBTQI plus
No, I didn't
chat
realize
and
that.
text. Yeah.
Well, I was really fascinated by their services for veterans and military families and wondering if there are ways that we can maximize that, because I think so many of our members struggle, not because they don't want to serve that population, but they struggle with getting paid. And so if they've got a method for doing that, that would be something I'd love to explore too. Oh, so we're heading to TAMHO, our state association, and they are the voice for our members in their state legislature.
Our state is investing funds to ensure that kids who are in middle school and high school understand about career pathways to behavioral health. Yes.
Wow, we need to get talking about this because lots of other states were wanting things like this.
Yes. In 2023, the General Assembly appropriated $3 million for a scholarship fund. If an individual is interested in getting their master's degree, they can be eligible for up to $15,000 for 2 years to pay for that master's degree. And then they, in turn, agree to work for a TAMHO member or a TADIS member who's contracted with the state. So we've been able to give out more than $1 million so far. And our commissioner has asked for $4 more million because it's been so popular.
Yeah. You know, you're small but mighty.
That is exactly what we are, small but mighty. It was really great having Chuck here today to hear what's happening within our state.
What really struck me was the way that over time, their legislature has come to both understand, value, and invest in behavioral health. I really enjoy getting on the road, going out and meeting with members, hearing from them what they're worried about, and then trying to come up with ways that the National Council can help them. The consistent thing I tell my staff all the time is our job is to make our members' jobs easier.